From the JAMA Network, this is the JAMA Medical News Podcast, discussing timely topics in clinical medicine, biomedical sciences, public health, and health policy, featured in the medical news section of JAMA.
Welcome to this special episode of JAMA Medical News. I'm News Director Jennifer Abbasi. Listeners, you're in for a real treat today because my guest is none other than Dr. Kirsten Bibbins-Domingo, Editor-in-Chief of JAMA. Kirsten, welcome to the show.
Thanks so much. I'm excited to have this conversation.
I'm so excited that you're here to unveil with me our very first Research of the Year roundup. So here's how it worked. For the first time ever, we asked JAMA's deputy and senior editors to nominate their favorite studies published in the journal over the past year. We asked the editors to nominate the papers that they thought were the most impactful, the most newsworthy, the most novel. And we asked them to tell us why they chose what they did. Studies were eligible if they were published between October of last year through September of this year. Then we handed their nominations over to you, Kirsten, and executive editor Greg Kerfman to make the final selections. And then the Med News team, Kate Schweitzer, Rita Rubin, and Samantha Anderer, put together this awesome feature story on the studies that we're publishing today. So, Kirsten, the Research of the Year list spans 9 observational studies and clinical trials across a range of health topics, from heart disease to dementia to artificial intelligence and much more. Today, we're going to touch on all the studies that made the list, but I want to start by asking you about, when you think about these studies that the editors nominated and that you and Greg ultimately selected, how do you reflect on them? What strikes you about them?
Well, I think they speak to areas that are really hot areas in research right now. They speak to clinical conditions that are really of great importance to patients, to clinicians, to the public health community, things like cardiology, things like the use of new therapies like the GLP-1 receptor agonist. They also speak to the range of methods that investigators are using to answer important questions, and I think the combination means that they reflect what our readers hopefully think are important and will affect their practice, as well as what the research community is doing in innovative new ways to try to get at answers to these questions.
Okay, so without further ado, let's talk about the list.
Okay.
2 of the studies that rose to the top for our editors were cardiology papers. One was a trial of the investigational drug lorundrostat for people who struggle with uncontrolled and treatment-resistant hypertension. Good news, this agent, which targets dysregulated aldosterone production, was effective at lowering systolic blood pressure in this trial. The other cardiology study the editors selected was a heart failure investigation. It was an observational study that looked at the association of GLP-1 receptor agonists on heart failure hospitalization and all-cause mortality in people with heart failure with preserved ejection fraction. Specifically, these patients had obesity-related HFpEF and type 2 diabetes, and the researchers compared outcomes in patients who either used a GLP-1 drug or sitagliptin, which served as a placebo proxy. They found that those who were on a GLP-1 drug, specifically semaglutide or tirzepatide, had a 40% lower risk of the composite outcome. So why do you think the editors nominated this paper?
Right. So this is a very interesting paper. This is a clinical trial emulation study. And so it is an observational study, but it's using advanced methods to try to get at a very important question about the use of these GLP-1 receptor agonists in the specific population with heart failure with preserved ejection fraction. And I think why it makes an important contribution to the trials of these therapies is that it's using essentially real-world data. It's using data on a large number of participants, nearly 60,000 participants. It's a larger, much more diverse group. And I think it really helps us to understand how this real-world evidence can complement the clinical trials and give clinicians more and patients more confidence in the use of these therapies for improving heart failure outcomes, which is really important.
You mentioned the use of the real-world data for this study. Another paper that made the list this year also had a really noteworthy design. This study found an association between shingles vaccination and a lower risk of dementia. Can you talk about how the researchers set up their study to examine this association and why that was a smart way to do it?
Right. So observational studies of vaccines really are often prone to this healthy vaccinee bias. That is, that people who choose to be vaccinated are somehow different from people who choose not to be vaccinated. And they might be more health conscious. And so that might bias in favor of the vaccine when you look at observational studies. What these investigators used was sometimes called a quasi-experimental design. They're trying to use more innovative, newer observational methods to help try to simulate, to make the two comparison groups more similar, less prone to these types of biases. These investigators are using real-world data in Australia, and they took advantage of the fact that people were eligible for the vaccine in Australia if they were born after a certain date, and they weren't eligible for it if they were born before a certain date. And so, since the difference between the two groups is just the date, the idea is that these two groups are essentially going to be more equivalent. And so you can compare the outcomes between these two groups that only differ essentially by one day to see what their outcomes are. And that's what makes the study very interesting and intriguing, in addition to the question, which was whether the vaccination for shingles actually has a relationship to dementia risk.
Now, this isn't the only research study in recent years to demonstrate a possible protective association between the shingles vaccine and dementia protection. And our deputy editor, Preeti Malani, said this research raises all kinds of questions about the role of viral infection in dementia. Now, Preeti, who is an infectious disease physician, also nominated another paper that made the list. This was the Beehive trial, which tested a hepatitis B vaccine with a novel adjuvant in people with HIV. This investigational vaccine generated protective antibodies in a greater proportion of participants than the conventional vaccine. So this is an important finding with potential implications for people who are immunocompromised and many other groups of people who may not mount an adequate response to the current vaccine for hepatitis B. Okay, let's come back to dementia. Another paper that you selected was a randomized clinical trial, the Pointer trial, that examined the cognitive benefits of a lifestyle intervention for older people who were at risk for dementia. Both groups in the trial were encouraged to do things like increase their cognitive, physical, and social activities, but one group had a much more structured intervention. And that group's cognitive function improved more over the 2-year study. So what makes this trial one of the most important of the year?
Well, I think we as a society and individually are concerned about dementia risk, and we're concerned about the many things that we can do to identify the risk of dementia and ideally to intervene to delay or hopefully prevent someone from getting dementia. And we have known that lifestyle interventions, the things that we eat, our exercise, our social engagement, those types of things are important. But we've not known whether in a more structured way, in a clinical trial setting, whether you can actually delay the onset of dementia. And essentially, that's what these investigators have done. They have conducted a 2-year study, a pretty large study over 5 clinical sites, and they are showing that lifestyle matters and that a structured way of engaging in these types of lifestyle interventions that include diet and exercise, that you can have a beneficial effect on the progression. And that's very exciting.
Okay. Now, rounding out our neurology papers on this year's list was a clinical trial about blood transfusions in people with acute brain injuries. This study, the TRAIN trial, which our editor said could be practice-changing, identified a hemoglobin threshold for blood transfusions in acute brain injuries. This paper is approaching 100 citations, so it's clearly an important one. Okay, Kirsten, next let's talk about an oncology trial that made the list this year. The COMET randomized clinical trial compared guideline concordant care with active monitoring for low-risk ductal carcinoma in situ. In this trial, active monitoring with surgical intervention only as needed was non-inferior to usual care, which was surgery with or without radiation. The outcome was 2-year risk of invasive cancer of the same breast. Why is this such an important finding?
Right. So low-risk ductal carcinoma in situ is an important condition, but mostly it's important because we want to know how to help guide patients who are worried about progression to breast cancer, but who actually have a low risk of it. And so the question has been whether we should manage this with surgery and with more aggressive treatments, or whether we can do more active monitoring, waiting to see if something that signals higher risk emerges. And what this trial suggests is that active monitoring can be an approach that is safe for women and their clinicians who might choose that approach if they don't want to have the surgical or the more aggressive medical management options. And I think it opens the conversation. It helps to guide clinicians and patients to make decisions when there is an important finding that suggests a higher than average risk, but still a low risk. And I think it opens up the conversation for doctors and patients.
So is this a case where less may be more, or at least just as good?
I think this is a case where we want to know, certainly women who have this diagnosis are concerned and clinicians are concerned. But we also are equally concerned about treatments that may have their own complications, or treatments that might themselves be not something a patient is really interested in. What this says is we don't have to opt for those treatments right away if that's something a woman chooses, that we have the ways we can watch over time until we know a little bit more about whether risk is elevated and then decide to intervene. More research, as always, is needed, but what this study does suggest is that that option, if a doctor and patient chooses it, is a safe option to choose.
Okay. Kirsten, so much of the research JAMA publishes is around prevention. One paper that made this year's list really underscores that focus. It reported early results from the Guardian study, which is evaluating a genome sequencing approach to newborn screening. The researchers found that a genome sequencing analysis that looks for variants in a predefined set of genes is not only feasible, but can also detect a wider range of treatable health conditions than standard screenings. Deputy Editor Linda Brubaker, who nominated this one, said the approach could be nearing potential clinical utility. And what I thought was interesting was that more than 70% of patients who are approached for the study consented to it, so there's probably less apprehension around newborn genome sequencing than many may think. Now, Linda also nominated the last study we'll talk about, which is on a very different topic, but a very hot one: artificial intelligence. This was a systematic review that looked at evaluations of large language model applications in healthcare settings. In other words, it was a study about AI studies. The researchers found a lot of shortcomings in these evaluations. For example, only 5% of the roughly 500 studies they looked at used real patient data. And the studies tended to assess the tool's performance on medical knowledge, not admin tasks like taking clinical notes and assigning billing codes, the manual labor that burned out physicians could really use help with. So what's your takeaway from this analysis, and where do you think it puts us or points us in terms of where the research on large language models in healthcare should be going?
Well, there's certainly a lot of enthusiasm about AI in general, and about AI and its potential ability to contribute to making the processes of healthcare easier, the front office work in healthcare easier, and hopefully outcomes for patients better. I think what this study reminds us, by systematically looking at what the evaluations are, is that they really are in a very narrow scope. Not things really related to patient outcomes. They're related to very discrete tasks. Can a model pass a USMLE test? And that's something that, while it tells us something, it only really speaks to a very narrow scope of what we hope these models could do to improve patient outcomes, or what we hope these models can do and maybe even are being adopted for, which is helping in the healthcare processes that they're working in. And so I think it guides us. By doing the systematic look at what has been studied, it says, here's what we need to study. These are the way the tools are being adopted, or where we'd like them to help us to improve patient outcomes. And this is the areas that we need more studies. So I really like that they focus on the use of real patient data, on quantifying the bias, and really on prioritizing administrative tasks, because that is one where it is really important for improving healthcare processes, both for clinicians and for patients ultimately. But we know far less about how these tools actually work for those tasks.
Okay, well, Kirsten, that rounds out our list of JAMA's Research of the Year. I loved chatting with you about this important science.
Yes, it's really great. We were really pleased to publish this. I think it's a very exciting year in terms of the types of science that's out there, as well as the implications of these findings for clinical practice, for clinicians and for patients. And so it's great to talk to you and to reflect about what's been published.
Okay, so we'll link to the Research of the Year news story in the show description, and from there you can find links to all of the studies we discussed today. That's it for this episode of JAMA Medical News. I'm Jennifer Abbasi. Thanks to my guest, Editor-in-Chief, Dr. Kirsten Bibbins-Domingo. This episode was produced by Daniel Morrow at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.